Can you see my screen?
Yes, we can see it.
Okay. So hi everyone, I'm Klarita, one of LAMSA's ambassadors here in Montreal. And today I'm going to be talking about overdose. So the key points for today, I'm going to be first defining what overdose is, the different types of overdose, risk factors for it, reasons behind it, why people do it in the first place, the symptoms of overdose, what happens when you overdose in the body, and the details about each type, specifically for opioids, stimulants, and alcohol, prevention, how to help in an overdose situation, and the treatments. So overdose is an intake of a toxic or poisonous amount of a drug or a medicine. It's an emergency that requires immediate medical attention. Not all types of overdose are fatal or life-threatening. However, medical advice should always be considered when an overdose occurs. So here are some quick facts and numbers just to show you the increasing amount of overdose that are happening. So we can see that over the years it's increasing, and it especially increased since the pandemic. We can also see that it's higher in male than females. In Canada, for example, there's approximately 20 deaths per year due to overdose, which is a huge number. And also in 2018, 12.7% of Canadians aged 15 years and older reported that they used opioid pain relievers, which is also a very high number. So here are the common types of substances that could lead to overdose. We have opioids, which are prescription painkillers, like oxycodone, hydrocodone, codeine, and others. There's illegal drugs such as heroin, synthetic opioids like fentanyl. We have also alcohol, which I would detail later. There's also benzodiazepine, which are tranquilizers, and it's a class of drugs that can treat conditions such as anxiety, seizures, and insomnia, like Xanax, Valium, and Ativan. There's also stimulants that make the person feel more awake and energetic. Examples of those are amphetamine, crystal meth, and cocaine. So the risk factors for overdosing, it's when a person takes more than one substance at the same time, especially if it's opioids. It's when there's a high dose or frequency of drug use, when there's mixing of drugs that could lead to dangerous interactions, when the body is not used to a certain substance, when there's a previous overdose history, when there's underlying health conditions such as kidney or liver disease, which would make it harder to metabolize a drug. And age could also play a role, especially in young adults and elderly, because in young adults, like there's inexperience with drugs, and in elderly, it's more of a decline in organ functioning. So the reason for overdose could be accidental or intentional. Accidental is when a person takes the wrong substance or a wrong amount or at a wrong time without knowing that it could be harmful for them. And intentional is when the person takes a substance in order to cause self-harm, like a suicidal attempt or a cry for help, or to feel relaxed and happy. No matter what the reason is, we shouldn't be the ones judging, because a lot of factors play a role in this, environmental factors, socioeconomic factors, other family and personal factors that could affect the reason why people are overdosing. So symptoms of drug overdose are vomiting, severe stomach pain, diarrhea, chest pain, dizziness, loss of balance, seizures, confusion, hallucination, snoring, pale face. It really depends from a case to another and from a person to another. It also has a huge impact on mental health, causing lower motivation, anxiety, depression, irritability, difficulty with sleeping, could be too much or too little, and behavioral changes. So what happens in the like physiology of the body to cause an overdose, it's well, first the body experiences central nervous system depression when there's an overdose in opioids or alcohol, and this will result in decreased rate of breathing, decreased heart rate, creating a euphoric feeling. An overdose of that will cause loss of consciousness, respiratory failure, and could lead to death or coma. So to go furthermore into opioids, opioids and stimulants are the most common ones used, and the opioids are primarily used to treat pain. The way they work is by increasing the dopamine levels in the brain, and dopamine is the feel-good hormone, which is responsible for pleasure, and this induces a euphoric feeling. So the human body has opioid receptors in different areas, including the brain, but more specifically in the brain, in the area that is responsible for breathing. And so when they are activated, they slow the whole body down, but especially respiration. And to reverse overdoses in general, we use what we call antidote to reverse this overdose. And what is used for opioids is naloxone, which I will also detail later. The other common types that I mentioned is stimulants, which also increase dopamine levels in the brain. They increase in this case, they increase the heart rate, blood pressure, body temperature, and breathing. And this will affect the cardiovascular system, respiratory system, and blood circulation, causing the body to be overworked to the point of breaking down and causing seizures. Regarding alcohol overdose, alcohol is a depressant which slows down speech, reaction time, and movement. Alcohol overdose happen when you drink more than the body safely processes. And what the problem here is that a lot of people are not aware of what like 1 cup of alcohol is. And so here's just a picture just to show you the equivalency between like a cup of beer or like a cup of wine, a cup of whiskey, just so people are more aware. And in case of an overdose, what happens is that the person takes more than what the body can safely process, which is more than 4 drinks for women and more than 5 drinks for men within 2 hours. That's on average. And the body will not be able to metabolize it fast enough, and it will spread throughout the body, causing poisoning. And the symptoms for that are confusion, vomiting, seizures, slow breath, irregular heartbeat, hypothermia, and painness. And this could lead to organ damage, like damage for the pancreas, but also permanent brain damage and possibly death. Okay. A drug that Montreal is warning about lately is it's called zombie drug or xylazine, which is an animal tranquilizer that is used in veterinary medicine, and it's not meant for human use, but it's being used with opioids, leading to also like overdose symptoms, breathing issues, irregular heartbeat. And yeah, to prevent overdose, it's important to read medication labels carefully, to take prescription as directed by keeping the medication in their original packaging, and really keeping them in a safe place away from children especially. Avoid drug use unless advised by a doctor, and let your doctor know if you've had an overdose before. Return the medication if you no longer need them to the pharmacy, and be careful when taking different substances at the same time. Talk to your doctor about it, make sure everything is going well. And it's also important to educate ourselves about programs and naloxone programs and substance use disorders, so we can help in that. To respond to an overdose, like if we assist to someone that's having an overdose, it's important to be aware of the steps to take, and we can call them the save me steps. So the S stands for stimulate, and in that case, we try calling the person or shaking them up to see if they're responsive. If they're not, we call 911. The A stands for airway, and so it's important to check the respiration and the respiration of the person, and if not, we should ventilate. It's one breathe every 5 seconds. We evaluate, we check how the breathing is going, um, and then we should inject antidote to reverse this overdose. In the case of opioids, it's called naloxone, and naloxone is a fast-acting drug used to reverse this opioid overdose. It works by kicking opioids off the receptor in the brain and binding to them. And so with that, it restores the breathing within 2 to 5 minutes. It's safe for all ages and can be sprayed or injected. And so after spraying or injecting it, we evaluate and support, and we wait for 5 minutes. If the person is breathing again, then we're good for the moment. If not, we do this again. And so after managing this emergency overdose, the person should follow up with a physician. A healthcare professional may request a lab test, other medical procedures, and they would be the one that know what should be done and provide supportive care. So it's really important to seek medical help as soon as possible for the people concerned. The government of Canada, for example, offers resources that could help, such as Wellness Together Canada, drug rehab services, CAPSA peer support, Alcoholic Anonymous, and Smart Recovery. So if you want to help someone, you could just let them know that they should check these resources. So in conclusion, addiction is not just a choice, it's more complex, but it is treatable. There's a lot of negative attitudes and beliefs about overdose. People face a lot of discrimination and judgment and isolation, but we should remember that there's many reasons related to it, and no one chooses to be addicted, so we really should be there to support these people no matter what. So our role here to end the stigma is to not define a person by their drug use. It's to be respectful and compassionate, to educate our friends and family about this matter. Remember that it is a treatable condition rather than a choice, and to be aware of our attitudes that may be influenced by stereotypes. Yeah, so that's it for me. If you have questions, let me know.